Welcome to the WEG Veterinary Clinic. Compliments of the World Equestrian Games, and we have convened this clinic to have some of the best veterinarians in the world, and certainly in Lexington, Kentucky, here working on what are some of the top 750 equine athletes in the world. The question has been, what is the importance? Why do you need a WEG veterinary clinic here on the grounds when we have so many great veterinary clinics in the city of Lexington, Kentucky? And the reason is because these equine athletes and team veterinarians need almost immediate support, and they need it 24/7. We have nighttime veterinarians, nighttime students that are here. We have veterinarians walk in with a problem from minute to minute. You can't do that by having it off-site and not immediately available. An excellent question is, what kind of injuries happen to these athletes? And you can see, again, transport-related problems, shipping fevers, dehydration, and those are fairly common, and we deal with those on a daily basis here. But they're minor problems. Most of those horses come around, compete, and are very happy by the time their competition rolls around. The other things that we'll see, and we have an entire separate, larger group of veterinarians prepared to deal with, are any injuries that might happen during competition. There are veterinarians available and standing by at every arena or every venue that we're competing in. Endurance, driving, eventing, cross country. They're standing by, ready at all the jumps and ready to go ahead and do the work that's needed. What you see over here is an area for the team vets to get information, an area here of display and information at our reception area. We have 50 radios that are dispensed out to a variety of veterinary groups. And here you see our senior students, who we have 33 of here, and they're working on the passports and organization of the arrival exams for all 750 horses. The reason we're able to hold the World Equestrian Games in the United States at all is because we have two important competition waivers. One is for pyroplasmosis, and we have 100 pyroplasmosis horses here competing in a variety of disciplines. We also have a contagious equine metritis waiver for mares and stallions for affected countries, and they're here. The students are helping us monitor that program. If you look over this direction, what you'll see is another one of our diligent veterinary senior students here working on our laboratory setup that's in-house. Rood&Riddle, who's the official veterinary hospital of the Games, is also helping us by their clinical laboratory being available around the clock, as well as their pharmacy being available. But we have an in-house laboratory for immediate blood tests, and numerous of the team veterinarians are taking advantage of that testing. What you see back here are digital X-ray and digital ultrasound partner here, which is Sound Eklund, are busily have us networked all around the clinic, and we're able to go ahead and take images and see them on these variety of workstations. Here you see a workstation set up. You'll see some radiographs, ultrasound that we've taken yesterday and today, and I'll show you the treatment area in a moment, but these are on separate workstations so the teams have privacy as they're accessing this information. Again, we have our clinicians to help them do those exams. Within the clinic here, you also see to my left the pharmacy. Again, this is stock courtesy of Rood&Riddle Equine Veterinary Hospital. And what we have is the only thing that the team veterinarians and teams are paying for here in this setup is the cost for the pharmaceuticals that they need to treat their horses and the fluids, and then also the minimal amount that they're charging for the laboratory analysis. The in-clinic laboratory analysis is free, all the exams are free, all the diagnostic imaging is free. This is the treatment area for the World Equestrian Games Veterinary Clinic, and what you see behind me is one of the primary farrier stations. There's another farrier station for general farrier work outside, and the American Farrier Association is staffing this. This particular truck and rig is designed for veterinary podiatry, and this is the Root and Riddle, which is our official veterinary sponsor. This is their rig. They'll bring their podiatry veterinarians in here to work on this. We have a number of specialists from a variety of clinics actually around the world staffing this facility, but certainly the podiatry veterinarians are very important to it, and that's staffed by the Root and Riddle crew. And they can do amazing things with the shoes on horses, and of course the shoes on horses are critical to their competition. They have to have the right shoe, they have to have it comfortably fitted to their foot, and they have to be able to move and compete in the manner that they're used to. If they've torn a shoe off, they don't pull them on and off like we do every day. Theirs are actually nailed to their feet or in special circumstances attached with the fiberglass resin. So it's very important as to the application, and that's why you see this setup here can machine shoes, can modify them, and can do almost anything you want with a specialty shoe for an athletic horse. What you see here is we have a variety of medicine specialists within our group as well, and what they're heavily involved with is how the horse's airway is doing. Some have had very, very long trips, both by air and by truck. If they arrive, sometimes they'll have a little fever from that, and so we support their team veterinarians with our medicine specialists, making sure their airways are open. Here you see a nebulizing unit that we use to help open the airways. We have some medications that they can use right now. As they get closer to the games, they'll have to quit those medications because they have to compete on their merit. What you'll see over here are a variety of ultrasound and x-ray machines. We have x-ray units that are large and on stands, and we have x-ray units that are small and portable, can be used on the distal extremities. They're wired into these networks, and the networks then go into very specific image servers and are distributed out to the imaging stations and are linked off-site for off-site backup and the ability for us to send these images around the world to other veterinarians or across the street or to Root and Riddle. We can do any of that as the team veterinarian or the competitor so desires. An additional area that we look at commonly in equine athletes is both their respiratory and their digestive tract. Just like humans do and human athletes, those are two important areas that need to be happy for these equine athletes to compete at a world-class level. So to that end, one of our WEG Veterinary Clinic medicine specialist, Dr. Bonnie Barr, is going to talk to us about the video endoscopy unit and how we use it.
Thank you. This is our unit that we have provided here by Root and Riddle, and we have two scopes, as Dr. Allen had alluded to. We look at the upper airway, and then we will also look at the stomach. The scope that I have here is the 1 meter scope. And the procedure that we do is we restrain the horse and we pass this through the nose up into the nasal passage, and then we're able to look at the upper airway to see if there are any problems that could result in the horse having poor performance. The other scope that we have is a 3 meter scope, which with that one we are able to look down into the horse's stomach to see if we see any gastric ulcers, which also can be a cause for poor performance or colic in the horse.
An important part of a World Equestrian Games or any major equine competition like this is communication. And we have, as you can see here, we have a whole battery of radios that the veterinarians alone operate with. And this allows us to talk to our veterinarians who are out there currently receiving horses from the Cincinnati quarantine. We have other horses that are arriving domestically in a different area that need different exams. We'll all communicate by radio or cell phone, but the communication aspect of it is critical. At night, if there's a problem in the barns, we have all-night veterinarians here, all-night veterinary student patrols. We're constantly looking for a problem among these horses, then talking to their team veterinarians and making sure we can assist them in dealing with any problems that they've encountered.